As you recall, on Friday, we reported that the administration announced that it was going to pretty much give up on the Class Act. Officials from Health and Human Services Department saying they will not try to implement the program, which had been facing a lot of criticism. They got the numbers, and it wasn't working. And according to Assistant Secretary for Aging Kathy Greenlee, she told reporters Friday, quote, "We won't be working further to implement the Class Act. We don't see a path forward to be able to do that." So Republicans had said, well, we're going to veto, or rather, we're going to repeal the law. And the White House pushed back and said, well, you know, we don't want you to do that. So I guess to explain this whole process and figure out where we are in this, we welcome to the program Senator John Thune, Republican from South Dakota. Senator Thune, thanks for being on the show this morning.
Great to be with you, Tim.
So the administration on Friday, and I thought the timing was interesting. It was kind of like at the end of the news cycle, if you will, because people don't pay quite so much attention on Saturday morning. But they announced that Class Act was not going to work. The numbers didn't make it work. Then on Monday, we got a scoring from the Congressional Budget Office, which indicated that it did not have the kind of deficit reduction that had originally been promised, and yet the administration is pushing back on repeal. So first, why are they pushing back, do you think?
Well, I think two reasons. One is they're very wedded to this idea. It's something that the left has wanted for a long time. It does represent a big expansion of government. It's a new entitlement program that would, I think, like some of the ones that we have already, create these huge unfunded liabilities that we're going to have to deal with and our kids and grandkids are going to have to deal with. But secondly, I think, Tim, they are very concerned about elements of the health care plan sort of coming apart and leading to the unraveling of the bigger bill. And this is sort of the first element of that has been proven now. The actuary was saying it even before it was voted on, but now it's been demonstrated as they have analyzed it further. And you had the Health and Human Services Secretary, Kathleen Sebelius, come out, as you said, on Friday and just say that this, we can't make this work at this time, which would lead you to believe then after the Congressional Budget Office came out and said, it doesn't score. Okay, well, let's repeal it. So I've been out talking about that, and the White House has now said, well, if the Congress repeals it, we may, we're very well may veto that. And I think it's a couple of those reasons. I think it's one is there are a lot of people who are very tethered to this idea on the ideological left, and secondly, it is an element of the health care bill, and I don't think they want to see the health care bill start to unravel.
Well, to the point, if the Department of Health and Human Services is not moving forward, if they are technically shutting down this whole point, what is the point then with having to go through the process of a repeal if they're not going to implement it anyway? Why do we need to repeal it?
Well, it's still on the books, and like I said, I think they're letting it go dormant for a while. I think they figure that the timing is bad on this, and they at least the models that they ran didn't work. But my sense is that they want to keep it around. There are a lot of people who are invested in this, and I don't know if you've seen some of these stories, but some of these groups on the left are now going on the attack, saying, why would the administration pull the plug on this thing? It's something that we need to do, and I just think that they are concerned that they don't want to appear to be completely walking away from this thing, and signing a bill repealing it would do that. And my guess is there's probably some hope that at some point in the future they may be able to resurrect it. So that's. But I think the reason we need to kill this thing is because it won't work in any form. I mean, the way this thing is structured, the way it's designed, it's just destined to fail. And we knew that going in, and everybody I think knew that going in. But they were completely politically committed to passing their health care bill, and they needed this as a pay for.
Well, I wonder if this is the problem for almost any kind of a program like this, wherein if you have voluntary enrollment, that the people who are going to enroll or the most likely to enroll would be the people who need it the most, which means that the people who would be able to sustain it, those who would not need the assistance, would not be participating. And therefore, you have a large pool of individuals trying to take advantage of a program into which a proportionally smaller number are contributing. And that is one of the problems with any kind of national program, is it not? I mean, unless everyone participates, then you're not going to be able to sustain any of these programs, or else unless you have a tax, I guess.
Well, and that's true, and that's what they actually did talk about, was making it mandatory, kind of like they did with the insurance, the individual mandate, is requiring everybody to participate, because otherwise you get what the actuary at the Health and Human Services Department described, and this is before the bill was passed. Remember, these things now this is coming out. The actuary over there actually said this would create an insurance death spiral. and that the adverse selection that would occur here would make it actuarially essentially impossible to accomplish. Now, he did say, which I thought was interesting, that in 36 years as an actuary and looking at this, that his view was it would collapse in short order and require significant federal subsidies. That was before it was voted on in December of 2009. That was the counsel and the advice the administration was getting, and they still moved forward with it.
No, you're talking about Robert Yee, the actuary for the program?
This is Richard Foster.
Oh, okay.
He was there at the time. I'm not sure. They may have some other folks. There were a number of people involved in this. I mean, there were a number of folks over there, the experts at the department, who were advising the administration as they were proceeding with the project.
Robert Yee was the one who was hired originally, and then he was let go about a month ago, and that was the one that started the rumor that this thing was on the way out.
That's
and as a result of that,
then
reporters had asked, and the White House had said, no, it's not in danger. And then, of course, we got the word on Friday that it was going to go.
Yeah, I think he was the guy that was supposed to administer the program. That's correct.
Well, the question, I guess, though, in a sense, this makes an argument for if there is to be any involvement whatsoever on a federal level in this, that it really almost has to be a program that is either funded by a mandatory tax or it has to be funded by mandatory participation in something like this, that it has to that would be the only way it could happen, assuming that it would pass constitutional muster. So other than that, I'm wondering, is there a way for the federal government even to get involved in any kind of healthcare reform?
Well, there is. I think this is a challenge we're going to face because people are living longer and the demographic shifts in the country, and long-term care is becoming an important issue for a lot of people. But I think that what you have to do is create a system through incentives, and you can do that through the tax code, other areas that incentivize people taking the right steps, taking the right precautions, without making it a required government program. Because you're right, other than having it, significant, massive taxes to pay for this, or a requirement that everybody be in, it doesn't work if the government does it. But I think the government can assist in that regard by providing the right sorts of incentives. And I actually had a bill in 2007 that allows people to take money from their 403Bs and 401Ks and set it aside for long-term care. And so there are some things out there, some ideas to deal with this issue. I'm not suggesting that this isn't an issue that we don't need to deal with, but the prescription that they come up with, which is always grow government, come up with a new program, attach a new entitlement that's going to put us on the hook for even more unfunded liabilities down the road. Mm-hmm. It just doesn't work.
It seems in a way, it's ironically, it actually helps buttress the argument, though, for a single-payer system.
Well, I mean, I think that in the end, which what a lot of folks want, and frankly, I think there were a lot of people in Congress when healthcare was being debated, that's where they wanted to get to, and I think that they are taking incremental steps to get there. I mean, they want to get it all at one fell swoop, and they couldn't. So this bill that passed in 2009 or 2010 really is it's a step toward that.
Before we go, and although everything that we have at this point has been unconfirmed about capture or death, but Muammar Gaddafi reportedly killed today, did you have any sort of immediate reaction to that news, if it is indeed true?
Well, I think it's obviously good news for the people of Libya, and if it is true, and of course you said it hasn't been confirmed, but I think that that's a country in transition, and his presence there, I think, continued to be a real liability in terms of their ability to move forward. And so, if in fact what is being reported ends up being confirmed, then it could be a new day for Libya.
Senator, we appreciate you spending time with us. Senator John Thune, always welcome. Thanks for being with us on POTUS.
Glad to be with you, Tim. Thanks.